You're sitting across from your child at dinner. You say their name, they don't look up, you say it again, still nothing. And for a moment, just a moment, you wonder, are they not hearing me or are they not here? That single moment might tell you more than any checklist, because what looks identical on the surface is often something very different underneath. This is just one of 10 differences between autism and ADHD that most parents and many professionals miss. And once you know how to read these moments, everything about how you see your child shifts. If you're watching this video, you're probably somewhere in the middle of figuring it out. You've noticed something. You can't quite name it. And the more you read, the more confused you feel. Because every list of symptoms seems to describe your child. And yet nothing fits perfectly. That confusion is not a failure on your part. It's a sign that you're paying close attention. In this video, we'll look at 10 subtle differences between autism and ADHD in children. Not to label, not to diagnose, but to give you a new lens, one that helps you see your child more clearly and feel more confident in what you're already observing. And a quick note, studies suggest nearly half of children with one of these diagnoses also have traits of the other. If you find yourself nodding at both sides, the need for routine and the boredom with it, trust that instinct. It might be both. Let's begin. These first differences reveal something fundamental: how your child understands and experiences connection with other people. Difference number 1, eye contact, discomfort versus distraction. You call your child's name from across the room. They don't look up. You call again. Still nothing. From the outside, this looks the same whether your child has autism or ADHD. But here's what's really happening. For many autistic children, eye contact isn't simply something they're not doing. It's something that can feel genuinely uncomfortable, even overwhelming. Processing a face while processing words is a massive cognitive task. Often, they look away not because they fear you, but because they are trying to listen to you. They are reducing the visual input so their brain can process the audio. It's not defiance, it's focus. In contrast, many children with ADHD want that connection, but attention has already moved on. Their gaze drifts not because yours feels threatening, but because looking away actually helps them think. They are reducing the visual input to better process your words. The eye contact isn't the problem. The cognitive load is. So the next time you notice this, ask yourself one quiet question. Is this about discomfort or distraction? The answer changes which door you walk through. Difference number 2, social challenges, understanding versus regulation. You're at a birthday party. Your child is listening to another child tell a story, and then, without warning, they're talking over them, finishing someone else's sentence. Already 3 topics ahead. You catch the other parent's eyes and feel that familiar flush of apology. This is where confusion often happens, because both autistic children and children with ADHD can struggle socially, but they're struggling with different things. An autistic child may genuinely not perceive the unspoken rhythm of conversation that most children absorb without ever being taught. It isn't that they don't care. They may simply not be reading the same social signals at the same time. A child with ADHD, on the other hand, often understands the rules. They know they're supposed to wait. They may even be trying, but the impulse arrives faster than the intention. They interrupt not to be rude, but because they are terrified, they will lose the thought entirely if they don't say it right now. One child needs the rules made explicit and visual. The other needs support in pausing before acting. Comprehension versus self-control. The behavior looks the same. The support needed is different. Difference number 3, communication style, processing versus expression. Have you ever had a conversation with your child that felt just slightly off, like you were both speaking the same language, but somehow not quite the same dialect? For autistic children, language often carries a very specific, literal weight. They often hear exactly what you said rather than what you meant. If you ask, "Can you get your shoes?" they might answer yes and not move. Because technically they can, but they miss the implied instruction to actually do it right now. The words land, but the intent behind them gets lost somewhere in between. For children with ADHD, the challenge flips entirely. They may have rich, complex, vivid ideas, but organizing them into a sequence someone else can follow is a different skill. Thoughts spill out mid-sentence, loop back, jump forward. It's not that the thinking is unclear. It's that the path between thought and language hasn't been fully paved yet. One child struggles with meaning, the other struggles with organization. And when you understand which one your child is navigating, you become a far more patient, and far more effective communication partner. You've just seen 3 ways your child experiences connection differently. But connection is only part of the picture. Underneath every social moment is something more fundamental. The way your child manages their inner world. How they find calm, how they handle change. Every child needs to feel safe. But the way a child creates that safety, how they seek predictability and balance, can look very different, depending on whether they have autism or ADHD. Difference number 4, repetitive behaviors. Comfort versus stimulation. Think about what an anchor does. In rough water, it doesn't stop the waves. It holds you in place so the waves don't carry you away. That's what repetition is for many autistic children. Not a symptom to correct, a tool, a way of staying steady when the world feels unpredictable. The rocking, the lining up of objects, the repeated phrase or sound, these aren't random. They're deliberate acts of self-regulation. What you may be seeing in a child with ADHD is something that looks similar but functions differently. Repetitive movement in this case is often the brain trying to wake itself up. An ADHD brain that feels understimulated might feel sleepy or foggy, so the child taps or bounces to generate the physical energy needed to focus. Regulation versus stimulation. The movement may look the same from across the room. The neurological need driving it is not. Difference number 5, response to routine. Need versus preference. You change the plan. Dinner is at a different time. A transition happens 5 minutes earlier than expected. A substitute teacher shows up instead. For many autistic children, routine is not a preference, it is a necessity. Predictability creates safety. When the expected pattern breaks, even in a small way, the disruption can register as enormous. The distress is real, not manufactured for attention. Children with ADHD can benefit significantly from structure. It helps them manage time, remember transitions, stay on track. But there's a distinction worth naming. The tension for a child with ADHD often isn't with sameness, it's with the repetition. A brain that craves novelty can feel physically understimulated by doing the exact same thing at the exact same time. One child needs the schedule as a lifeline. The other benefits from it, but fights the boredom of it. One is about security. The other is about stimulation. These are different conversations to have. Difference number 6, sensory sensitivities. Central versus secondary. Imagine a room that's slightly louder than comfortable. A shirt tag brushing the back of the neck. A fluorescent light humming just barely above silence. Now imagine that for your child, these aren't mild annoyances. They're unbearable. For many autistic children, sensory sensitivity isn't a side note. It is a defining feature of daily life. The way they experience sound, texture, light, taste, and smell can be profoundly, physically different. And it shapes everything. How they can dress, where they can go, what they can eat, how long they can stay before something breaks. In contrast, for children with ADHD, the sensory struggle is often about filtering. Their brain doesn't automatically tune out the background noise. The hum of the fridge is just as loud as your voice. It's not that the sensation itself hurts, it's that the brain refuses to filter it out. The scratchy tag isn't just annoying, it's a constant alarm bell. Their brain won't silence, making it impossible to focus on anything else. Ask yourself honestly, are there places your child can't go? Foods they've refused since they were 2 for reasons no one can explain? Clothes they reject the moment they touch their skin? If those patterns are shaping your days, that's a signal worth bringing to someone who can help. There's one more layer. What captures their attention? What loses it? And perhaps most importantly, what makes them want to try? The way your child engages with the world, what pulls their focus in and what lets it go, is where some of the most meaningful and most frequently missed distinctions live. Difference number 7, focus patterns. Narrow versus inconsistent. You've seen it. Your child can sit with a single topic, dinosaurs, trains, the history of a particular video game, for hours, completely absorbed, almost unreachable, and yet when it comes to schoolwork or a task they didn't choose, that same focus is gone inside a minute. For autistic children, this deep, sustained focus is often connected to what are called special interests, areas of intense, specific fascination, where the brain locks in and the rest of the world recedes. The focus isn't effort, it's absorption. For children with ADHD, the focus pattern is almost the reverse. Attention can be intense in the right conditions. a state researchers sometimes call hyperfocus, but sustaining it depends entirely on interest. The focus isn't a lifelong deep dive. It's often a cycle of intense passions that burn hot for a week or a month and then fade when the novelty wears off. A parent who understands this distinction won't see a distracted child and a rigid one. They'll see two children whose attention systems work differently, and they'll respond accordingly. Intensity versus inconsistency. Both look like a problem from the outside. Only one of them actually is, and it depends entirely on the context. Difference number 8, emotional reactions. Overwhelm versus regulation. Difficulty. Strong emotional reactions can feel like they come from nowhere. One moment your child is fine, the next they're fully flooded. Tears, frustration, withdrawal, or an explosive response that seems wildly out of proportion to what just happened. For autistic children, think of it this way. The brakes are there, but the road is unpredictable. These moments are often triggered by something specific. Sensory overload, a disrupted routine, a social situation that became too confusing or too demanding. The emotional storm doesn't arrive without cause. It arrives when a threshold has been crossed, when the nervous system has finally been asked for more than it can give. For children with ADHD, the road is smoother, but the brakes are still being built. The regulation system is reactive, often triggered specifically by frustration or perceived criticism. The emotion doesn't build gradually, it spikes instantly. And because the internal brakes are still developing, stopping that feeling is much harder than starting it. Trigger versus control. One child needs the environment adjusted. The other needs the internal system supported. Understanding which one you're in helps you respond before the moment escalates and helps you forgive yourself when it already has. Difference number 9, play behavior. Structured versus exploratory. Watch your child when they think no one is looking. How do they play when no one is directing them? Autistic children often gravitate towards structured, organized, and repetitive play, arranging figures in exact configurations, running through scenarios the same way each time, building elaborate systems with their own rules that must be followed precisely. The play has form. Deviation from the pattern can cause real distress. Children with ADHD often play differently. Their play is spontaneous, rapidly shifting, driven by what's just caught their attention. One toy leads to another. One game becomes a different game mid-game. Not because anything went wrong, but because something new appeared on the horizon. And that simply was more interesting than whatever came before. When you understand your child's play style, you're not just watching behavior, you're watching their mind at rest. Difference number 10, motivation, predictability versus stimulation. Every child is built for a different kind of road. Some are built for familiar ground, the path they've walked before, where every turn is known and nothing unexpected waits around the bend. Others are built for open terrain, novelty, speed, the feeling of not quite knowing what's coming. Neither road is wrong, but asking a child to travel a road they weren't built for, without understanding why it's so hard, is where the real struggle begins. For many autistic children, what they're built for is predictability, knowing what comes next, returning to what is known and trusted. Certainty is motivating. The familiar is where engagement lives. For many children with ADHD, the pull goes in a very different direction. Novelty motivates, stimulation engages, urgency provides the dopamine hit that routine simply cannot. A task that is new, slightly risky, or immediately rewarding will hold attention in a way that a predictable one simply cannot. When you understand which road your child travels, you stop asking why they won't walk yours. You meet them where they are. You find the path that actually leads somewhere for them. You may be noticing something right now. Many of the behaviors we've described, the avoidance, the social struggles, the emotional floods, the hyperfocus, the resistance to change, they can look nearly identical from the outside. In a classroom, at a birthday party, even in a pediatrician's office, they can look like the same child, struggling in the same way, for the same reasons. But the internal experience is different, profoundly different. For many autistic children, the world can feel overwhelming by its very nature. Sensory input is amplified. Social interaction requires conscious, deliberate effort that most people never have to think about. Unpredictability doesn't just feel inconvenient, it can feel threatening. And structure, sameness, and routine are not quirks. They are the architecture of safety. For many children with ADHD, the experience moves in the opposite direction. the world can feel understimulating. The brain is searching constantly for the level of input that allows it to engage. Novelty is fuel. Urgency creates focus. And the emotional system is still learning, still building the pause between feeling and reaction. Here's why all of that matters so much. When you mistake overwhelm for defiance, you respond with consequences. When you recognize it as overwhelm, you respond with support. When you mistake distraction for disrespect, you pull back. When you see it clearly as distraction, you move closer. The behavior hasn't changed, your understanding of it has. And that understanding changes the room. Think about the last time your child had a hard moment, a meltdown, a refusal, a shutdown, an outburst, and you didn't know what to do. You probably responded to what you saw because that's all you had. Now you have something else. You have a way of asking, what is this really? What does it mean? What does it need? That question, just that question, changes your voice. It changes what your child feels coming from you. And children who feel understood, even once, carry that. If this is the kind of content you want more of, subscribing takes 1 second. What you do with this begins with how you see your child. When you look beneath behavior, you respond with more patience, more clarity, and support that truly fits. Not because you lower expectations, but because you understand what your child is experiencing. Choose curiosity over judgment, observation over assumption, support over comparison. Your child doesn't need you to have every answer. They need you to keep trying to understand. And that effort alone helps them feel seen. You're already doing that. And sometimes the clearest answers show up in the smallest moments. The unfinished homework, the wandering attention, the energy that never seems to settle. If you want to recognize what those moments may be revealing, the next video on your screen shows you exactly what to look for.